Hello, my name is Dr. Reshma Mahtani. I am Chief of Breast Medical Oncology at Miami Cancer Institute, Baptist Health, South Florida. The use of bone targeting agents has been investigated in various early stage breast cancer trials with the hope that these drugs may not only help improve bone loss, which we know is a common consequence of our therapies, but also to decrease the risk of recurrence. Prior studies have demonstrated that bone-targeted agents like zoledronic acid, for example, given intermittently, increase bone density, reduce fractures, and may also improve disease-free survival in patients on aromatase inhibitors. So with that background, the ABCSG18 trial was a prospective randomized placebo-controlled double-blind phase 3 study that started now about 16 years ago and included over 3,000 patients that were recruited primarily in Austria and Sweden. Included were postmenopausal patients with early stage hormone receptor positive breast cancer who were candidates for treatment with adjuvant non-steroidal aromatase inhibitors. And these patients were randomized to receive either 60 milligrams of Denosumab subcutaneously every 6 months or placebo. So this trial had many endpoints. It had 6 endpoints, and the time to first clinical fracture was the primary endpoint. And together with changes in bone mineral density and vertebral fractures, this endpoint was reported previously. At ASCO 2022, the endpoints of disease-free survival, bone mass-free survival, and overall survival were reported. So as mentioned, the earlier endpoint of percent of risk fractures was previously reported, and in that analysis, it demonstrated that adjuvant denosumab significantly increased the time to first clinical fracture and essentially cut treatment-induced fractures in half. So in terms of the other endpoints that were reported at ASCO 2022, with a median of 8 years of follow-up, this represented the long-term outcomes of disease-free survival, bone metastasis-free survival, and overall survival. As far as the patients that were included in this trial, these were patients that we commonly see in clinic, postmenopausal breast cancer patients with a median age of in their mid-60s. 72% had 2 centimeter or smaller tumors, 71% had node negative disease, and all of these patients had hormone receptor positive breast cancer. 25% of them had received adjuvant or neoadjuvant chemotherapy. So this study did demonstrate that denosumab improved disease-free survival by 17%. This translated into, the hazard ratio was 0.83, and this translated into an absolute difference of 4.5% at 9 years of follow-up. Additionally, bone metastasis-free survival was also improved by 19%, and overall survival was actually improved by 20%. In terms of toxicities, we were particularly interested to see the rates of osteonecrosis of the jaw, which we know is a side effect of bone-directed therapies. Although a rare condition, it is something that from a quality of life standpoint does considerably negatively impact patients. In this trial, not a single observed case was noted, and this may be due to the low dose that was given and the intensity of the treatment. So as we put these data into context, it's important to note that this was a relatively low risk population. Again, as I mentioned, only about 25% of them had received prior chemotherapy. The therapy overall is easier to administer than bisphosphonates. It's a subcutaneous injection as opposed to an IV treatment, but it's also more costly, and that has to weigh in as well. In the absence of having any direct comparative trial with bisphosphonate, which is frankly unlikely to happen, we again come back to the need to individualize decisions for our patients. But again, the good news is we have more tools in our toolbox to help decrease the risk of recurrence for our patients with early stage hormone receptor positive, HER2 negative advanced, early stage ER positive, HER2 negative breast cancer.